Sorry, doctors, there was a technical problem. I hope it's resolved now. Okay, so let's get back to what we had already discussed. So we were discussing about the formation of the heart tissues. Okay, so one Sorry for the technical problems, doctors, but let's get back to the uh, heart tissue formation in this early bell stage, like how it is happening. So the what is happening in this heart tissue formation is that the inner enamel epithelial cells, they will induce the formation of the odontoblast in the underlying connective tissue here. Okay, so these inner enamel epithelial cells, they will induce the formation of the odontoblast in the underlying dental papilla or the underlying connective tissue here. And from the connective tissue, these cells will get differentiated to form the odontoblast. And this odontoblast will start forming the dentine. Okay. Once this odontoblast start forming the dentine, once the first layer of dentine is formed, that will act like a trigger, or that will like induce the inner enamel epithelial cells to get converted into amyloblast. And this amyloblast will start forming the enamel. Okay. Now, once this enamel and the dentine are formed, what happens is that since the heart tissues are formed, till now, this inner enamel epithelial cells are getting nutrition from this dental papilla only. Okay. But once this heart tissue is formed here, the nutrition supply of this inner enamel epithelial cells will get blocked. Okay. So these cells need nutrition to survive. Okay. So what it does is that, for again, a really good mechanism is happening here. What actually happens is that these stellate reticulum cells are here, right? These stellate reticulum cells that are seen above this inner enamel epithelium. What happens to these cells is that they get collapsed. Okay. Now, what happens when they get collapsed? What happens is that this outer enamel epithelial cells and this dental follicle, okay, this dental follicle and or the dental sac, they will come in close contact with the inner enamel epithelial cells. Okay, so and they take nutrition from this dental follicle cells. Okay, here also there are like lots of blood vessels and lots of fibers that are present here. So from these cells, from these blood vessels and everything, these inner enamel epithelial cells will start getting his nutrition. Okay, so that is the reversal of nutrition is happening here. That's the first thing that is happening. The reversal of nutrition is happening. Okay, so before that, in the heart tissue formation, we see something called as the uh, the reversal of nutrition is happening here. Okay, so basically how the reversal of nutrition is happening is till the heart tissue formation, the inner enamel epithelial cells are getting their nutrition supply from the dental papilla cells here. But once the heart tissue is formed, since it's a heart tissue, okay, now these blood vessels cannot penetrate and go and give the nutrition to the inner enamel epithelial cells. So what they does is that they will start getting nutrition from another source. Okay, that is the dental follicle. Okay, but the dental follicle is a little bit far away from this inner enamel epithelial cells. Okay, to make them close, what it does is that this stellate reticulum, it will just collapse. Okay, once it just collapses, what happens is that this inner enamel epithelial cells, they will come in like very close contact with the dental follicle cells, and that will result in the uh, giving the nutrition supply to the inner enamel epithelial cells. Okay, so I hope that's clear now. Okay, and now let's move on to the advanced bell stage. Okay. So in the advanced bell stage, mainly two things are happening. Okay. In the advanced bell stage, the one thing that is happening is the mineralization. Okay. So the hard tissue is laid down and it is getting mineralized. Okay. Lots and lots of like inorganic content and organic content is getting deposited in these hard tissues and it is getting mineralized. Okay. And the another main thing that is happening in this advanced bell stage is the root formation. Okay. So in the advanced bell stage, what is really happening is that usually the dentino-enamel junction is getting formed. Okay, so there was one more structure that was seen in the early bell stage. So just before the enam or the hard tissue formation, this junction that is between this inner enamel epithelium and between this dental papillae, that is be a delicate junction. So that junction is called as the membrana preformativa. Okay, so this membrana preformativa is what is forming the future dentino-enamel junction. Okay, so there is like a thin membrane that is present between the inner enamel epithelium and the dental papilla. So that is called as the membrana preformativa. Now this membrana preformativa is what is forming the future dentino-enamel junction. Okay, so like I had already mentioned, these inner enamel epithelial cells, they will, first thing they do is like they will induce these cells that are present in this dental papilla, and so many cells that are present in the dental papilla that will get converted into odontoblast. Odontoblast will form dentine, and this dentine will induce the formation of, induce the conversion of this inner enamel epithelial cells into amyloblast, which will again form enamel. Okay, so it is like a completely like a interrelated process. Okay, once this forms only, that is happening. Okay, like that, it is completely interrelated process. Okay, so that is called as this reciprocal induction. Okay, so this reciprocal induction during the development stage is seen in like very few structures in our body, like teeth or kidney or somewhere, like very few structures of the body only shows this reciprocal induction. And one such main important structure is our development of teeth. Okay, so this reciprocal induction, this term is very important. In early bell stage, you will be seeing the reversal of nutrition. In advanced bell stage, the reciprocal induction. Okay, that term is very important. Okay, so the enamel is formed here, the dentine is formed here, its mineralization is happening. Okay, now next is the root formation. How is this root formation happening? Okay, root formation alone is a separate mechanism. Okay, so we'll see how this root formation is happening. Okay, so the main structure that helps in the formation of root is nothing but it is the Hertwig's epithelial root sheath. Okay, the main structure which helps in the formation of this root is nothing but it is the Hertwig's epithelial root sheath. Okay, so what happens is that, and there is like enamel and dentine formation that is already happening in the crown area. Now, when this enamel and dentine formation, when it reaches the reaches the future, when it reaches the future cemento-enamel junction, what happens is that then the root formation happens. Okay, so this enamel and dentine formation is already happening in the crown and it's starting forming. And when it reaches the future cemento-enamel junction, then we will see the formation of the root. Okay, for the root formation, mainly the structure that is formed is the Hertwig's epithelial root sheet. Okay, so this Hertwig's epithelial root sheet is nothing but it is formed by two layers of cells. Okay, the first one layer is the outer enamel epithelium and the other one is the inner enamel epithelium. Okay, all the cell structure, the cell shape will be very much similar to what we had discussed in the early bell stage and cap stage and all. So this Hertwig's epithelial root sheath is formed. Okay, once this Hertwig's epithelial root sheath is formed, what is does is that it will start growing to the underlying structure here. Okay, it will start growing downwards, and at one point it will be like placed horizontally like this. Okay, this Hertwig's epithelial root sheath will be growing down, and at one point it will be placed in a horizontal point like this. Okay, so this horizontal plane is called as the epithelial diaphragm or the plane of diaphragm that we call. Okay, this plane of diaphragm is also very important. Now what happens is that in the Hertwig's epithelial root sheath, there will be inner enamel epithelial cells and the outer enamel epithelial cells. Okay, it is formed just by the two layers of cells. One is IEE and the other one is the outer enamel epithelial cells. These inner enamel epithelial cells, just like they induce the formation of the dentine in the early bell stage that we had already seen. Here also what they does is they will induce the formation of the odontoblast, and the odontoblast will start forming the dentine. Okay, but when the first layer of dentine is formed, it will not induce the inner enamel epithelial cells. Okay. And the crown part, once the first layer of dentine is formed, because of the reciprocal induction, it will induce the inner enamel epithelial cells to ameloblast, and ameloblast will form enamel. But in the crown section, it is a completely different mechanism. Okay. Here, the cells are like not inducing it to form the enamel or anything, but there's no reciprocal induction happening. The inner enamel epithelial cells will remain as such, as short only. They will not become tall columnar and all. They will remain short only. And what happens is that this Hertwig's epithelial root sheath, because of the dentine, a hard tissue is formed. What happens to this Hertwig epithelial root sheath is that it will loses its continuity. Okay, you can see in the diagram here. Okay, this was continuous Hertwig's epithelial root sheath. Because of the formation of the dentine, what happens is that it will lose its continuity and it will form like very small islands. Okay, the small islands of cells of the remaining remnants of this Hertwig's epithelial root sheath, they are called as the cell rust of molasses. Okay, the remnants of the dental lamina were called as the cell rust of serrae, whereas the remnants of this Hertwig's epithelial root sheath, that is called as the cell rust of molasses. Okay, these terms are very important because this from this cell rust of molasses only, one of the most common cyst that we see in our oral cavity is developing. Okay, so these terms are very important. You will be like learning about this more in your third year. Okay, so this Hertwig's epithelial root sheath loses its continuity, and what happens is that surrounding we have the dental follicle. Okay, so these dental follicle cells, they will start proliferating and they will invade in between this Hertwig's epithelial root sheath. Okay, and these cells in the dental follicle, they get differentiated into cementoblast, into osteoblast, into fibroblast, and every all the differentiation of the cells of the dental follicle are happening, and it will form the other structures of the tooth, like the periodontal ligament, the cementum, the bone, and all the other structures will be formed because of this differentiation of cells from the dental follicle. Okay, so this is a general mechanism of root formation. There is Hertwig's epithelial root sheath, which has two layers of cells, outer enamel epithelium and the inner enamel epithelium. It will start growing. At one point, there will be a plane of diaphragm will be forming, and the inner enamel epithelial cells again induce the dental papillae cells to form the odontoblast. This odontoblast, they will start forming the dentine. Once the dentine is formed, this continuous sheath of this Hertwig's epithelial root sheath is cut off, and lots of infiltration by the continuously proliferating dental follicle cells will come, and they will infiltrate into it. And in the dental follicle cells, they will get differentiated into like cementoblast, osteoblast, and fibroblast, and all those cells, and they will start forming the other structures that are seen in the root part of the tooth, that is the periodontal ligament, cementum, and the bone, alveolar bone, and all are formed. Okay, now what is the importance of this plane of diaphragm? We will see that here. So from this plane of diaphragm, like two extensions, how this is what we see in a normal single rooted tooth. Okay. For a normal single rooted tooth, this is the general thing that is happening. But in case of a multi-rooted tooth, like for a mandibular molar or for maxillary molars, how it is happening is that from the epithelial diaphragm, there will be two tongue-like extensions. Okay. In case of two-rooted teeth, there will be two tongue-like extensions. In case of three-rooted teeth, like the maxillary molars, there will be three tongue-like extensions and the root will be developing around it and form. Okay, so that is the general mechanism of the Hertwig's epithelial root sheath and the root formation. Okay, now this flowchart is given in your Orban's textbook also. It is like extremely important when they ask you about the Hertwig's epithelial root sheath or the mechanism of root sheath. Always draw these flowcharts. Okay. Now, this table is also given in your Orban's histology. This table will really help you in your last minute revision also, like what are the layers, how many layers are seen, what are the cells seen, and what are the events occurring. You just have to look at this table during your last minute revision. Okay, so uh, keep just try to draw this table in your notebook or just take a printout of this table and like paste it where you can see daily and keep looking at it daily. Okay, so that all the stages of the tooth development will be thorough for you. Okay, now that's all about the morphological stages of tooth development. Now coming to what is known as the physiological stages of tooth development. So the physiological stages of tooth development is like a little bit deeper study. Okay, we are going into the what is happening for each cell like that. So the physiological stages of tooth development are mainly five stages are there. One is the initiation. Next is proliferation, histodifferentiation, morphodifferentiation, and apposition. Okay, so in initiation, what happens is that around like 6th week, 7th week, there will be formation of dental lamina and there will be formation of the tooth buds. Okay, so how this dental lamina, tooth buds, and all the tooth development is mainly happening is by the interaction between the epithelium and the underlying ectomesenchyme. Okay, so this interaction between this epithelium, overlying epithelium, and this underlying connective tissue is like very important. And mostly this initiation process happens at different times for different teeth. And if some problem or if some defect is happening in this initiation process itself, then that can lead to something called as anodontia or oligodontia or like supernumerary teeth or abnormal teeth in abnormal locations. All these are formed just because of some defects happening in this initiation process. Okay, so these are the clinical implications of the initiation process. Okay, so if the dental lamina is not even formed, then what happens is that then the tooth formation does not even take place. Okay, so then what happens is that then the tooth is not formed at all. Okay, so anodontia means complete absence of teeth. Okay, so in a patient, if you are seeing not a I'm not talking about aged patient who has lost all the teeth from the birth itself, uh, like after 6 months and all, the tooth eruption starts happening. But in a child with anodontia, you will not be able to see any teeth erupting. Okay, the child will be like completely edentulous. Okay, anodontia means complete absence of teeth, and oligodontia. Okay, oligodontia means missing one or two teeth. Okay, like maximum like one or two teeth will be missing. Like the usually the mandibular premolars will be missing, or like that the there'll be missing of the teeth. Okay, one or two teeth will be missing. That is called as a oligodontia. Okay, supernumerary teeth means extra teeth. Okay, so extra teeth will be seen in case of the supernumerary teeth. Okay, usually seen extra tooth is between the two central incisors here. Okay, that is known as the mesiodonts. Okay, that is the usually seen extra tooth that is seen. Okay, and teeth in abnormal locations. Okay. Then next is proliferation. Okay, in proliferation, what is happening is that there will be the cell will be undergoing regular change in its size and its proportions also. Okay, so there will be regular change in its size and proportions, and in the proliferation stage, we'll be like able to see the final size and shape of the crown. Okay, like if it's a molar, it will have like 4 or 5 cusp, and if it's a uh, incisor, the shape of the crown will be seen in this proliferation stage. Okay, next is the histodifferentiation. In the histodifferentiation stage, what happens is that the cells will undergo both structural and biochemical changes. Okay, inside the cell organelles are like proliferating more, or they are like changing its structure that will result in the structural and biochemical changes. So in that, you will be able to see like the inner enamel epithelial cells, it influences to form the odontoblast. Okay, like we had already mentioned in the early bell stage and advanced bell stage, inner enamel epithelial cells, it influences to form the odontoblast. That is known as the histodifferentiation of the odontoblast. Okay, so these cells influencing the dental papilla cells to become odontoblast, that is known as the histodifferentiation. That is, histologically, it is getting differentiated into another type of cell. Okay, that is known as the histodifferentiation. Like that, once the inner enamel epithelial cells, it is getting converted into amyloblast once the first formed dentine is formed. Once the dentine is formed, okay, so that is known as the histodifferentiation of the amyloblast. Okay, so the inner enamel epithelial cells, they are getting converted into amyloblast, so it is getting differentiated. It is getting differentiated histologically. So that is known as the histodifferentiation of amyloblast. Now, in case of any defect in this stage, okay, in case of any defect in the histodifferentiation stage, like vitamin A deficiency, if vitamin A deficiency is happening at this stage, what happens is that the dentine that is formed will not be a normal dentine. Okay, it will be like a defective dentine. Okay, so such dentine is called as the osteodentine. Okay, remember the name. Such dentine is called as the osteodentine and is mainly caused due to the histodifferentiation defects. Okay. Now next is morphodifferentiation. Okay. In the morphodifferentiation, the morphological form and shape is determined by its differential growth. So both the in the morphodifferentiation stage, if you look at it, both the dentinoenamel junction and the dentinocemental junction, okay, the junctions will be like well formed, and based on this junction only, the shape of the crown and shape of the cusp and all are determined. Okay, so the hard tissues, the enamel and the dentine, they are getting deposited based on the shape of this DEJ and DCJ only. Okay, so this was one question that I asked today in the WhatsApp community. Like if there is any defect in the morphodifferentiation, what form of tooth is formed. Okay, one example is the supernumerary cusp. Okay, sometimes an extra cusp will be seen in some of the teeth, or sometimes an extra root will be seen in some of the tooth, or peg laterals. Peg laterals are nothing, they're like small lateral incisors that you see in some people. Okay, so they are called as the peg laterals, and there is the dilaceration. Okay, dilaceration means like a sharp bend in the root of the tooth. Okay, if the root of the tooth is like this, if some trauma or some injury is happening during this morphodifferentiation stage, then what happens is that the tooth will start forming at a different angle. Okay, so such sharp bends in the tooth, they are called as the dilaceration. Okay. Sorry for the disturbance, doctors. So that's about the morphodifferentiation. So next, going to apposition. What happens in apposition is that there will be deposition of the matrix of the dental hard tissues. Okay, so already the matrix is laid out. Then what happens is that lots and lots of like organic and inorganic minerals are getting deposited above this matrix, which will result in hardening of the hard tissues. Okay, so this deposition of matrix of dental hard tissues, it is known as the apposition. Both organic matrix and calcification and mineralization is happening at this stage. So any defect during this stage will result in something called as the hypoplasia or the defects like amylogenesis imperfecta, tendinogenesis imperfecta, which you will study in detail in your third year, is happening because of this apposition defects. Okay, so these are the 5 stages of physiological stages of tooth development and the clinical implications of each stage. Okay, like if one stage is like defective in nature, then what is happening there, okay, is mainly seen here. Okay. Okay, so these, if a question was asked on the morphological and physiological stages of tooth development, then these are the key points that you should include. Okay, you can take a screenshot or you can write it down. So these are the key points that you should definitely include in your answer sheet if you are writing about the morphological and the physiological stages of tooth development, or if you are, or if particularly one stage is asked, then you should write about the first an introduction, like this is the first stage of tooth development, or this is the second stage of tooth development, and how the enamel organ is looking here, how the dental papilla is here, how the dental follicle is here, and if it's cap stage, then write about the transitory structures, and always draw diagrams also. Okay. Now let's see about what happens to the dental lamina. Okay, so we had already talked about the 6 week of by about 6 weeks, the dental the primary epithelial band is forming, and it is getting divided into dental lamina and vestibular lamina. Now, dental lamina, what it will have two types of extensions. Okay, the one extension is the distal extension. Okay, so if you look at the distal extension of this dental lamina, it will give rise to enamel organ of non-succedaneous teeth. Okay, what is mean by non-succedaneous and succedaneous teeth? Okay, let me tell you about that. So succedaneous means it has a predecessor. Okay, it has a predecessor means there is a primary teeth that is formed before the formation of this teeth, and this tooth is erupting in the place of a previous primary tooth. Okay, so that is known as a succedaneous teeth. Okay, so that is the succedaneous teeth will have a predecessor. Predecessor means a primary teeth will be there in its place before it starts forming. Okay, so such type of teeth are called as the succedaneous teeth. Okay, central incisors, lateral incisors, the canines, your premolars are all succedaneous teeth. Okay, now what are non-succedaneous teeth? Non-succedaneous teeth means it does not have a predecessor. That is, it is getting formed. Uh, it is getting formed. It is the first teeth that is getting formed in that particular place. Okay, there is no predecessor for it. Okay, the main example is the molars. Okay, the molars form the molars. The permanent first molar, it erupts behind the deciduous second molar. Okay, so it doesn't have a predecessor. Okay, so such teeth are called as the non-succedaneous teeth. Okay, so you have the succedaneous teeth and the non-succedaneous teeth. Okay, from the distal extension of this dental lamina, usually enamel organs of non-succedaneous teeth are formed. Okay, non-succedaneous teeth means the molars. So the enamel organs of these molars are formed from this distal extension. Okay, and from the lingual extension, which is also called as the successional lamina. Okay, so remember, from the successional lamina, succedaneous teeth enamel organs are formed. Okay, so that is an easy way to remember. MD, molars from the distal extension of the dental lamina, all the other teeth, which are called as the succedaneous teeth, from the successional lamina, which is the lingual extension of the dental lamina. Okay, so from the other teeth, all these other successional lamina is formed. And then next, in the primary epithelial band, it is again divided into dental lamina and the vestibular lamina. From the vestibular lamina, our oral vestibule will be happening. Okay, it will take a dip and will form a vestibular lamina. Okay, so what is the active period of dental lamina? Okay, so the first teeth the first permanent teeth that is forming will be the first molar. Okay, first permanent molar, which the formation will start by around 4th month in utero. Okay, so from 4th month in utero, by about 5th month, the central incisors will start forming. By about 10th month, the second premolars will start forming. And after the birth, by about 1st year, the second molar, the second permanent molar will start forming. And by around 5 years, the third molar will also start forming. So from 4th month in utero till the 5 years of age, only this dental lamina will be active. Okay, after 5 years, this dental lamina will start disintegrating, and it will form like epithelial islands, like small cells will form its epithelial islands like this, and those small cell rust, they are called as the cell rust of Savin. Okay, and if the cell rust are like silent, then you will not be, it is not usually a problem creator. But once like some problems happen with this cell rust of dental laminae, then only we will see the formation of tumors or cyst or like that. Okay, so this is about the dental lamina and the fate of dental laminae. Okay, so this flowchart is very important in the discussion of this dental lamina, like what happens in the 27th day, about there will be rupture of the buccopharyngeal membrane, and there will be connection between formed the or about 6th week, what is happening, the primary epithelial band is happening. All these flow charts is very important. It is there in your organs, and these are the key points that you should include if they ask you about the dental lamina and its fate. Okay, about the formation, extension, degeneration, cell rust of Surrey, and the clinical importance. Okay. Now, next commonly asked questions that is like very much that important is the life cycle of amyloblast and added note on amylogenesis. Okay. Life cycle of amyloblast and the amylogenesis is a very important topic. Okay, so if you look at the life cycle of amyloblast, it is divided into 6 stages. Okay, so the what are 6 stages of this life cycle of amyloblast? There is an easy way to remember it. Okay, remember this mnemonic. Mom orders food for Mira, that is pizza from Domino's. Okay, so it is morphogenic, organizing, formative, maturative, protective, and desmolative. Okay, so these are the 6 stages in the life cycle of an amyloblast. Okay, morphogenic, organizing, formative, maturative, protective, and desmolytic. Okay, so these are the 6 stages in the life cycle of an amyloblast. Now let's see what is happening in each stage. Okay, the process that we are going to explain here is like very much similar to the, what we had described about the enamel formation and the dendrite formation there. But here we are going into a more deeper level, and we are looking at the inner enamel epithelium, particularly how it is changing into amyloblast and how the enamel matrix is getting formed. Okay, we are describing about that in detail here. Okay, so in the morphogenic stage, what is happening is that this is the normal inner enamel epithelial cells with a centrally placed nucleus. You can see this is the proximal end. Proximal end means the one facing the stratum intermedium, and this is the distal end. Distal end means the one facing the dental papillae. Okay, so the nucleus will be centrally placed here, and there will be mitochondria, endoplasmic reticulum, and Golgi apparatus. Normally, how many you see in a cells? Normal amount will be there. Okay, so what happens here is that this inner enamel epithelium and this adjacent mesenchymal cells will be there, right? In the dental papilla cells, they will start to interact. Okay, they'll start to interact, and the shape of the dental enamel junction and the crown can be determined in this stage. And the cells will be usually low columnar, centrally placed nucleus. Golgi complex will be present in the proximal end, and the basal lamina will be there. And just underneath this basal lamina, in the dental papilla region, you will be able to see a cell-free zone. Okay, cell-free zone means it will be devoid of any, no cells will be there. Okay, only fibers will be there. No cells will be there in the morphogenic stage. Okay, now from the morphogenic stage, it will go into this organizing stage. Okay, it's all like a story. Okay, if you study it like a story, it will be more easier for you. Okay, so in the organizing stage, what happens is that the cells will become longer. Okay, the shape of the cells will be much more longer. And as you can see here, the location of the nucleus. Okay, look at the location of this nucleus. The nucleus from the center, it is going upwards. Okay, it is going to the proximal end towards the stratum intermedium. Okay, so the nucleus is going upwards, and you can see lots of endoplasmic reticulum here. and lots of mitochondria and the Golgi complex. Okay, the Golgi complex is coming down and lots of endoplasmic reticulum is seen here. Okay, so the change in shape of the cells will be there, and the dentine, the odontoblast will get differentiated and they will start forming dentine in this organizing stage. So the nucleus will shift towards the stratum intermedium. Nucleus will go up and shift towards the stratum intermedium. That is called as the reversal of polarity. Okay, this reversal of polarity is an extremely important thing because what happens is in this is that the usually for a cell, how it will be like that is the nucleus will be arranged at the center of the cell and it will be towards the basement membrane. Okay, if this is the basement membrane and if this is the cell, the nucleus will be arranged at the center and towards the basement membrane only the nucleus will be there. But in case of the amyloblast, what it does is that the nucleus will be pushed upwards. Okay, nucleus will be pushed upwards because the Golgi and the endoplasmic reticulum are all coming down. This nucleus will be pushed upwards, and what happens is that that will mainly to compensate the nutritional mechanism also. Okay, so since the nucleus needs the most amount of nutrition and the nutrition now they are getting from the stratum intermedium and all those cells, this nucleus is going upwards and getting nutrition from that. Okay, and here more and more of Golgi complex is here. Okay, now from the organizing stage, next we will go into the formative or the secretory stage. Okay, so in the secretory stage, what happens is just like the name suggests, secretion of the enamel happens. Okay, once the first formed dentine is laid down, what happens is that it will induce these cells to form the enamel, and the inner enamel epithelial cells, they will get differentiated into amyloblast and they will start forming the enamel, and junctional complexes are formed. Okay, these junctional complexes are nothing but they help in the secretion of these heart tissues in a particular line. Okay, and as you can see, there will be like extension. Okay, like small cell processes will be seen at the end of these cells, which are called as the Tom's processes. Okay, this Tom's processes are nothing but they are the distal extension from the amyloblast, and through this to this Tom's processes only, this enamel will start forming. Okay, so that is about the formative or the secretory stage. The next we have the maturative stage. Okay, in the maturative stage, what happens is that the amyloblast will become short. Okay, here they were like in a very columnar shape, but here they will become like a little bit short and they are attached to the enamel matrix. Okay, enamel has formed and they are attached to the enamel matrix, and there will be two substages in this maturative stage. One is the transition stage and other one is the modulation stage. Okay, in the transition stage, what happens is that about 25% of the amyloblast, what it does is that it will stop the secretion and it will undergo apoptosis. Okay, apoptosis means cell death. Okay, about 20%, 25% of the amyloblast, what it does is that it will stop the secretion and it will undergo cell death. Okay, and in the second stage, that is in the modulation stage, what happens is that more and more of organic material is removed and inorganic material is deposited. Okay, so this cells will show something called as ruffled borders like this. Okay, ruffled borders and smooth borders will be seen in the maturative stage of this amyloblast. Okay, so if the ruffled borders, what it does is that it will allow inorganic material to enter the cell. Okay, and the smoothened border, what it does is that it will allows the exit of the organic material. Okay, so when inorganic material enters only, like more and more mineralization and calcification happens. So this ruffled borders allows more amount of the inorganic material to enter it, and the smoothened border, when the smoothened border appears in the cell, that means that it is like exiting the lots of organic material from inside the cell. Okay, and the Tom's process will also be lost in this stage. Okay, so that's about the maturative stage. Now look, if you look at the protective stage, in the protective stage, look at the shape of the cell. Okay, it has become cuboidal in shape, and after enamel formation, the cells, they just lost the columnar nature of the cell and they become cuboidal, and they now look very similar to outer enamel epithelial cells. Okay, like how I had described the outer enamel epithelial cells, they now look very similar to the outer enamel epithelial cells, and it forms something called as the reduced enamel epithelium. Okay, the size of the cells are reduced to cuboid, so that's why they are called as the reduced enamel epithelium. So this reduced enamel epithelium, it does nothing but it acts as a protection. Okay, it acts as a protects the mature enamel till the eruption. Okay, that's the main function of this reduced enamel epithelium. Already the enamel is laid down. So the main function of this reduced enamel epithelium is it acts as a protection for this already formed enamel matrix. Now, the last stage is the desmolytic stage. Okay, desmolytic stage is a stage just before the eruption. So what happens is that this reduced enamel epithelium, it secretes lots of enzymes. Okay, these enzymes, what it does is that it will destroy all the connective tissue around the tooth. Okay, it will destroy all the connective tissue around tooth, and it will go and bind with the overlying epithelium, overlying oral epithelium. Okay, once it binds with the overlying epithelium, it will create like a path for eruption of this tooth. Okay, so that is what is happening mainly in the desmolytic stage. Okay, it will create a pathway for the tooth eruption with the help of this reduced enamel epithelium. Now, while I was going through all the like 10 to 15 years of the university question papers, okay, these are some of the most important questions that were like frequently asked. So in the right side, in the left side, you have the most frequently asked questions. And in the right side, you have some of the surprise questions that were asked in the exams. Okay. So periodontal ligament fibers, one of the most frequently asked essay question, periodontal ligament fibers. Um, because of the time restriction only, I'm not discussing all these things, but you must have a look at it before you go for the exam. Okay, the first one is the periodontal ligament fibers, then next is the oral mucosa and the ultrastructural findings of the keratinocytes. Okay, another very important question, acellular cementum, a short note question, circumvallate papillae short note, maxillary sinuses, histology and functions, the short notes questions, interglobular and intraglobular dentine. Okay, all these are like very important topics that you should definitely look before going into the examination. Okay, these questions are important, and these questions, okay, these questions are surprise questions. Okay, like these questions are not frequently asked, but in the university exam paper, if you see, there will be always one or two surprise questions in the brief note section. Okay, there will be definitely one or two surprise questions in the brief note section, so you can expect such questions also. Pulp stem cells, pulp stem cells are a little bit high end for a first year BDS student, but this was a brief note question that were asked in the recent January 2024 examination. So, and the age changes in pulp. Okay, some of these questions I will discuss with you in the WhatsApp community. Age changes in pulp, the rusting and reversal in lines of bone, branchial arches. There are like a little bit of like overlapping topics with the anatomy also. Masseter and all you will be studying in the anatomy itself. So it will be easy for you to write. Compensatory curve, ligament traction theory, alkaline phosphatase theory, theories of tooth eruption, and theories of mineralization. Both are very important. Okay. Shift of dendo-gingival junction, pericytes. What are pericytes? Okay. That also you should have a look on. Okay. It was asked only in one paper, but it was like a unique question that is not usually seen. Okay. Then dentine hypersensitivity, theories of dentine hypersensitivity also you should have a look on. So these are some of the most important questions that you should have a look on before going into the examination. If time permits, I will discuss some of these questions either live or in our WhatsApp community. Okay. Now, some of the most common problem that the students tell is that they didn't get enough time while writing the exams. Okay. So you should improve your time management skills. Okay, so what are the ways to improve your time management skills? Okay, so you have the essay questions for 20 marks, then the short notes for the 20 marks, and the brief notes for the 30 marks. Okay, essay questions, you have two essay questions, and the four short notes, and the 10 brief notes will be there. Okay, so in the essay question, usually I will always ask you to start with the essay questions first. Okay, because that carries the maximum amount of mark. Okay, so start with the essay question first. Okay, these are some tips that you can use in the examination hall. Okay, when you go for the examination. Okay, start with the essay question, and for every section, okay, like for essay questions, take 1 hour, short notes, take 1 hour, brief notes, take 1 hour. Okay, sorry, only 1 hour for one section. Okay, once the 1 hour is over, just stop writing whatever you are writing, stop writing and go to the next session. Okay, don't sit on that topic. Okay, this is a very important time management skill. Okay, so for essay question, you have two essay questions. Half an hour you can take for one essay, and half an hour you can take for the other essay. Okay. Short notes, you have 5, divide it accordingly, and brief notes, you have like 10, divide it accordingly. But mostly for essay questions, utilize only 1 hour for it. Okay. For the short notes, utilize only 1 hour. Okay. Once the 1 hour is over, don't again sit on that same short notes, or don't again sit on that same essay questions. Okay. Move to the next section. Okay. Then when you get time after like writing all the questions, then come back. Okay, that is one important time management tip that I can give you. Okay, try using this tip when you are writing your model exams, or when you are writing like practicing for exam. Try utilizing this time management skill, and then tell me how it's working for you. Okay, so if you have any doubts, you can ask now. Okay, so less than like 30 days remaining for your examinations. You should do continuously revision, and revise and revise. Okay, otherwise, you may feel like you are forgetting stuff. Okay, especially the anatomy and all. Anatomy is very vast and volatile. So keep revising, keep revising. Okay, go through it daily. Okay, and have a fixed study plan also. Okay, have a fixed study plan and study for it. Okay, all the best for your examinations. Do well. Fly out with like colorful color. Okay, fly out. Okay, very okay, do well, and all the best for your preparations also. If you have any questions after this live has ended, you can put it the questions under this video. Okay, after the live session has ended, you can put the questions under this video. We will definitely answer it. Now again, I'll be coming with a live session for dental anatomy. So we'll see you there. Okay, so all the best for your preparations. Do well. Good night.